Welcome everyone. In today's talk, we'll be reviewing some of the diabetes monitoring devices available. We will be reviewing some of the different diabetes monitoring devices, as well as the importance of reviewing blood work. We'll be reviewing blood sugar patterns and how they can impact your possible diabetes progression and cardiovascular risk, as well as how you can make a lifestyle change by reviewing the readings of your day-to-day blood sugar management. These are the methods we will be reviewing in this talk. The first one will be blood work. The second will be your own glucometer. And the third will be continuous monitoring of blood sugars. The example provided is from a Libra device. Here, we'll be discussing blood work. Now, blood work is something that you will be completing regardless of what type of device you are using in regards to checking your blood sugars. The primary reason you are checking for blood work is for your 3-month average in regards to your blood sugars. Now, blood work is the most accurate test that can be taken in regards to measuring the sugars in your body. Now, the 3-month test, or A1C, when it comes to your blood sugar, is a very important test, as it has helped to diagnose those who have diabetes and to see what your progression is overall from year to year when it comes to your blood sugar control. But it does not paint the entire picture, as it does not capture day-to-day variations when it comes to your blood sugars. In the example provided, we see 3 different individuals with an A1C, or 3-month average, of 7%, which is the target for those who are living with diabetes. Now, as you can see, the person on the example number 3 is on target 100% of the time. And as you can see in the other 2 examples, there is quite variation in high and low readings. But at the end of the day, all of these individuals have an A1C of 7%. As you can plainly see in the first 2 examples, the A1C is not able to capture these highs and lows, but rather takes an average of the entire days and the 3 months when it comes to your blood sugars. How do we capture changes from day to day when it comes to your blood sugars? The main device that is used is a glucometer. Okay. For those who are familiar with a glucometer, it is the device that is mostly used. It is used to check your blood sugars from day to day. Now, whenever you do check your blood sugars, there must be a reason for it. You don't want to be checking blood sugars just randomly. Please do follow up with your diabetes care provider in regards to how many times they would like for you to check your blood sugars during the day and also during the week. Number 1 reason to check would be to find out what your body response is to addition of new diabetes medications, especially when it comes to insulin. Rule of thumb is, whenever you are checking your blood sugars, you want to check as often in the day as you are taking insulin. So for example, if you are taking 1 insulin injection, you want to be checking at least once a day. If you are taking 4 insulin injections, for example, you want to be checking at least 4 times a day. Number 2 reason for checking your blood sugars. You want to know what your body is responding to the meals you are eating. We don't always eat the same thing from day to day, or even from meal to meal. So whenever you are trying a new recipe or eating out, it may be advantageous to check your blood sugars 2 hours after that meal and see what your response is like. You may want to change the way you're eating based on that reading, or perhaps the reading's on target and you enjoy your meal, and this could be a new meal that you could regularly have more often. Number 3 would be exercise, especially if you're taking insulin. You want to see what your sugar management, sugar control is like whenever you are adding exercise to your daily routine or whenever you are increasing your exercise. And of course, if you are ill. If you are ill, there is a likelihood that your sugars could increase because of the hormonal changes happening in your body when you are sick. So please check your blood sugars when you are sick, because they could actually increase because of the illness. The two examples provided are for what are called continuous glucose monitoring devices. The one on the far right is a Libra, and the one in the middle, in the bottom, is from a Dexcom. There are others available, but they all pretty much work the same way. There is a sensor which you will attach to your body, either your upper arm or your abdomen, and this sensor has a little strip with some enzyme coated on it. Now, the glucose monitoring devices that you see here do not check blood sugar, but instead they check the sugar that is swimming around your cells. So when this sugar comes into contact with the enzyme coated on that strip that is attached to the sensor, you can capture a reading of what your sugars are being measured at that moment in time. Because you are not directly measuring blood sugar, there is about a 15-minute lag time when it comes to the readings that you show with these devices as compared to a glucometer. So for example, if you were to check both at the same time, your glucometer and your monitoring device that you see pictured here, the glucose monitor would be in real time. But these devices that you see in front of you would be 15 minutes behind. Regardless, they are still proving to be a great way to monitor your sugar management, especially for those of you who need to check your blood sugars multiple times in a day, or who are at a higher risk of having hypoglycemia, or what is called low blood sugar. Now, these devices are very good at capturing blood sugar variability. Now, what do we mean by blood sugar variability? We are talking about swings in your blood sugars. And we know whenever we have rapid swings, or as you can see by the picture listed, roller coasters where you have ups and downs, you have possible progression of diabetes being increased. Here we see an example of blood sugar variability. The red dots represent the times that this person checked their blood sugar using a glucometer. As you can see, whenever they checked with their glucometer, they were actually within the target zone. But they missed highs and lows. But these highs and lows were captured with continuous glucose monitoring. Some recommendations moving forward. Know what your medications do in regards to your diabetes. If you are taking insulin, know what type of insulin you are taking. What does it do? Also, in regards to your meals, aim to eat from a Mediterranean diet with more vegetables, whole foods, in order to be able to control your sugars better. And of course, if you do need help with either of these, come to us. As exercise therapists, we can refer you to diabetes education where you can get the help that you need. And of course, when it comes to your sugar management, checking your blood sugars, whether it's day to day or multiple times during the day, is an extremely important asset as you will be taking that information back to your diabetes care provider. We will finish with some take-home messages. Please use the monitoring device that best matches your needs. Just because a device can provide you with more information or is a newer device doesn't mean that it's the right one for you. Please review with your diabetes care provider in regards to your options available and choose the one that best suits your needs. Know your blood sugar targets. This includes what your sugar should be like when you wake up in the morning, before breakfast, before other meals, after meals, and so on. If your blood sugars are not managed, especially if you are having low readings with low blood sugars, contact your diabetes care provider. Use your blood sugar readings as a moment to reflect and to learn. If they're above target or below target, please don't feel guilt or self-blame. Use it as a moment to reflect and to learn. Think about why your readings could be at that number. Was it because of what you ate or did not eat? Was it too much exercise? Please Take it as a moment to reflect. And always remember, you are the most important member of the diabetes care team. Thank you. It has been a pleasure serving you.